Thank you so much for joining us to share the importance of good oral health in our family pets with our Family World readers. Can you tell me a little bit about your background as a board certified specialist in veterinary dentistry and why you're so passionate about educating pet owners about good oral health in their animals?
Yeah, thanks, Nicole. Basically, I am a veterinarian. I graduated in 1994, and after that, I did what's called an alternate residency. So I am a veterinarian, and then I specialized, kind of like being a surgeon or an internist or a cardiologist. I did a residency in veterinary dentistry. And so for the last 15 years, all I have done is work in animals' mouths. Typically, it's dogs and cats, but I do occasionally do lions and tigers and bears. And so, yeah, occasionally, not a lot, but I did a gorilla about 2 weeks ago, so that was kind of fun. And really, why am I here? Why am I so passionate? Why have I partnered with the Greenies brand to bring out oral health in dogs and cats? Simply said, oral disease is rampant in our small animal pets, especially small breed dogs, poodles, Yorkies, Maltese. Anything that is under about 15 pounds is going to have really bad gum disease, and almost all of them. And not only now do we know that it not only affects the mouth and also the regional areas like the eyes and the nose and the jaw, but which spreads throughout the bloodstream and affects the heart, the lung, the kidney, the liver, negatively affects diabetes, basically slowly kills the pets on a daily basis. And unfortunately, most clients and pet owners don't know anything about what's going on in their animal's mouth. So by bringing this out into the world, hopefully, we can better educate the pet parents who can then take care of their pets.
Gorillas, wow, I'm
Yeah.
so impressed. Most responsible pet owners keep up on their pets' general health needs. We take them to the vets, we get their vaccines, we make sure they get their yearly checkup. Is this enough to make sure their oral health is also at its optimum level? If not, what else should we be doing?
Well, that's a great first step. I mean, visiting your veterinarian on a regular basis, at least once a year, is absolutely critical. Now, back, 10 years ago, we got annual vaccines for our pets, and that's really kind of gone away. So a lot of pet parents aren't taking their pets in annually. And so what we do on the veterinary side and on the human side is we practice a lot of preventative care. We get our teeth cleaned every 6 months. We go and we get our checkups by our doctor. Well, unfortunately, in veterinary dentistry, it's so common for us to wait for there to be bad disease and then treat it. So what I'm trying to bring out is prevent, prevent, prevent. Go ahead and take care of it. So, going into your vet on a regular basis, asking them to look, because sometimes the vets won't look in the mouth on a general exam. So ask your vet, hey, how do my dog's teeth look? But you can do it at home as well. Now, all you have to do, hey, Tom, come here. Come here, buddy. All you have to do, if you can get Tom to wake up, all you have to do is lift up his lip and take a look. And you can see Tom, even though he's young, he has a little bit of redness right there. That little bit of redness is a sign of oral infection. So that's the first thing. You can also smell your dog's breath. If you don't want a kiss from your dog, he's probably got some pretty bad gum disease. And that's when it's really time to go see your veterinarian about it. But any time that you see any of that redness is a problem. And as far as taking care of them at home, well, ideally it would be brushing. If you could brush your teeth every day, you're really going to decrease the amount of times you need to come see me. But a lot of pet parents don't have time to do that. So there's a lot of chew-based treats that will really help with gum disease as well. There's a lot of them out there that may work. There's a lot of them that don't work. So if you want something that you know works, what you have to look for is what's called the Veterinary Oral Health Council seal of approval. It's vohc.org. And products like that, like Greenies, they work really well to keep especially the back of the mouth really, really clean, and that's the hard area to brush. So if you see that VOHC seal, you know it's going to work for you.
Okay, well, that kind of answered my next question about what can we do at home. Um, so, are there any treats that you don't recommend? Is there something that we should be avoiding then?
Yes, there are a lot of products that you need to avoid, and I can't list them all out, but the key is if you have animals that are chewing on things that are too hard, they're actually going to break the teeth. So what a good test is to take whatever treat you're going to use and try and make an indentation with your fingernail. If you can make an indentation with your fingernail, it's probably okay for your dog to chew on. If you can't, if it's too hard, then it's going to probably break the teeth rather than keeping them clean. So you want to stay away from things that are too hard.
Oh, wow. I didn't know that.
Yeah, I know. It's very common, and that's why I treat so many broken teeth, because so many clients are feeding their dogs or giving their dogs treats that are really hard because they
Yeah.
last a while. If they don't last a while, then they're like, oh, well, that was kind of a waste. But the problem is something's going to give. It's either going to be the tooth or it's going to be the treat. And so the treat's got to give before the tooth does.
Wow. Um, okay, what are the less obvious signs that we should look for in our pets? You mentioned about looking at the gums and the rotting teeth, and the bad breath. Is there any other subtle signs that aren't like that we won't see just looking in their mouth, like in their behavior or in other health issues that could indicate that there's a problem with their oral health?
Well, there is, but unfortunately, any systemic signs are going to be a really late sign of the disease. So if you're kind of waiting for your dog to slow down, to start feeling sick, to do things like that, in all likelihood, he has really bad disease. So the best thing to do is just to kind of lift up the lip and look and smell. If you see it, then that's an issue. There is actually a new periodontal diagnostic strip that you can actually use, your vet might have, and they can test for it and they'll find it early. But other than that, flipping up the lip and looking for it, but really, again, we go in for preventative care. So personally, as a veterinary dentist, I treat pets annually no matter what the teeth look like. I say, we go to the dentist. I tell clients this all the time. When do you decide when it's time to go to your dentist? Do you go in there and go, my gums aren't all that red, that tooth's not loose yet. No, you go every 6 months. And I think that that's one of the things we're trying to do, is we're trying to do preventative care for these dogs, get them taken care of.
Okay, that makes sense. Let's switch gears a little bit. Tell me about the program and your partnership with Greenies to help fund dental care for service dogs. What can our readers do to help promote that program?
Great question. Dogs like Tom, they are critical for their pet parents to be able to take care of them, and they need their teeth. They actually need everything to be healthy, and it starts in the mouth. But dogs like Tom and some of the other like Canine Companions for Independence dogs, where they actually use that. Tom's a guide dog, guiding eyes, and he really helps out his pet parent. So we need his whole mouth to be healthy. And so they actually are going to use their mouths in some ways as well. So AVDC, the American Veterinary Dental College, has partnered with Greenies to bring out a good care for the dogs, and it's called the Service Dog Program. And veterinary dentists around the country provide free oral exams for any service dog. And then if we find something that needs to be treated, then Greenies has a grant that actually will help them get that care that they need to keep them healthy for free. And so by your watchers, if they go to the Greenies Facebook page and like it, every time that somebody likes the Greenies page, they will actually donate $1 to Dogs Like Tom so they can take care of their mouths.
That is awesome. Service dogs are so important, and it's really, really a great program. So, do you have anything else that you wanted to add today?
Well, I guess the one thing is when you talk about taking care of your animal's teeth, a lot of people don't think about it until they're 5, 6, 7. They think of it as an old dog problem. It's not. The current studies that are out there are showing us that gum disease actually starts before the dog's even a year of age. So unfortunately, it's very common for people to wait and say, oh, I don't have to worry about it yet. You do. The current studies that are out there are showing that most dogs, 90% of dogs, have gum disease at 1 year of age. And so unfortunately, by waiting till they're 2 or 3, you actually have to treat it, and it's hard to get back there. So if we start treating them early, we start with home care, we brush the teeth, we feed them, VOHC approved treat like Greenies, all those things. If we start those things young, we're going to avoid having the problems down the line. So when you get a puppy, get your hands in their mouth, get looking in there, and prevent the disease.
Great. Thank you so much for joining us today. I really did learn a lot, especially about the treats. I had no idea. I have a shepherd. She's got flat teeth, but she likes to move rocks too.
Yeah.
So I kind of wondered, did we give her the wrong treats and encourage this or what?
Well,
But
that's a dog thing. They like rocks. They like doing things like that.
yeah,
But when it actually comes to chewing on something, give them something a little more pliable.
yes, yes. Well, she's getting older. She's 12 now, so I'll be sure to make sure that she's not getting too hard of treats. She doesn't like the hard ones anyway now.
Yeah,
So,
that's
but
not unusual.
thank you. I really appreciate you joining us today.
You're welcome, Nicole. Thanks for having me on.
Okay, have a great day.
You too.
Bye.